In Sudan's capital Khartoum, oxygen cylinders are being loaded into the back of a car. They are on their way to a coronavirus patient's home for private use. But most of those seriously ill with COVID-19 are facing an acute shortage of medical oxygen. That's partly due to power cuts that impeded production at the economically struggling country's main plant. Hussein Malassi, a senior manager at the Sudanese liquid gas company, says a lack of cylinders is another problem.
Before the severity of this pandemic, the distribution of cylinders over the hospitals was sufficient. What happened is that the consumption of oxygen increased several times with the pandemic, and the cylinders at hospitals did not increase with the same level.
A government survey found that 38% of oxygen cylinders have been smuggled out of the health system for private use. Some patients bribed hospital staff, others relied on personal relationships. Everyone else has been left in hospitals unable to provide adequate care during a third wave of infections. Montasir Othman, Director of Emergency and Epidemic Control at Sudan's Ministry of Health, said times of peak infections make clear the weak capacity of Sudan's hospitals. He added that the government is working to make more cylinders available. But it's not just oxygen. The country, which has recorded 33,000 cases and 2,600 deaths since the start of the pandemic, has just 300 ventilators. Out of 37 hospitals that can take COVID-19 patients, only 11 are in the capital, which has 70% of cases. Last month, officials said Sudan could meet just 40% of its need for medicines. Social media is awash with desperate pleas for help, as relatives seek oxygen cylinders, beds and drugs for their loved ones.